tired of the health insurance hunt? Feeling like you're lost in a sea of acronyms, deductibles, and copays? You're not alone. The world of health insurance can feel like a foreign country, but what if there was a way to navigate it with confidence, finding the perfect plan for you and your team without all the stress? For small business owners and their employees, finding the right health insurance isn't just a matter of checking a box. It's about empowering your team, attracting top talent, and providing peace of mind. And for many of you, that journey starts on Justworks. In this video, we're going to pull back the curtain on Justworks' health insurance comparison tool. We'll demystify the jargon, show you exactly where to look for the information that matters, and give you a step-by-step guide to comparing plans like a pro. This isn't just about clicking buttons. It's about making an informed decision that will impact the well-being of you and your entire team. So, let's start with the basics. What are the key things you need to understand before you even start clicking around on the Justworks platform? Think of these as your compass points. First, you have the monthly premium. This is the amount you pay every month to have the insurance. It's the most straightforward cost, but it's not the whole story. A plan with a low premium might look great at first, but it often comes with higher out-of-pocket costs later. Which brings us to the next point. The deductible. The deductible is the amount you have to pay for covered medical services before your insurance starts paying its share. For example, if you have a $3,000 deductible, you'll pay the first $3,000 of your medical bills for the year. After you hit that number, your insurance kicks in. But how much does the insurance kick in? That's where coinsurance comes in. Coinsurance is a percentage. It's the portion of the medical costs you're still responsible for after you've met your deductible. So if a plan has an 80/20 coinsurance, once you've paid your deductible, the insurance company will pay 80% of the costs for covered services, and you'll pay the remaining 20%. Finally, there's the out-of-pocket maximum. This is the absolute most you'll have to pay for covered medical services in a given year. It's your safety net. Once you hit this limit, which includes your deductible, copays, and coinsurance, the insurance company pays 100% of all covered costs for the rest of the year. Now, let's talk about the different types of plans you'll see on Justworks. The most common ones are PPOs and HMOs, but you'll also see EPOs and POS plans. Each one has a different set of rules about which doctors you can see and how you access care. A PPO, or Preferred Provider Organization, offers the most flexibility. You don't need a referral to see a specialist, and you can see doctors both in-network and out-of-network. However, seeing an out-of-network doctor will almost always cost you more. Because of this flexibility, PPO plans typically have higher monthly premiums. An HMO, or Health Maintenance Organization, is a more restrictive but often more affordable option. You'll need to choose a primary care physician, and that PCP is your gatekeeper for all other care. You'll need a referral from them to see a specialist, and you're generally only covered for care from doctors and hospitals within the HMO's network. An EPO, or Exclusive Provider Organization, is kind of a hybrid. Like an HMO, it only covers care from its specific network of doctors and hospitals. The key difference is that you don't need a referral to see a specialist. So you get that direct access without the out-of-network coverage of a PPO. And a POS, or Point of Service, plan also requires you to choose a primary care physician. But unlike an HMO, a POS plan allows you to see out-of-network doctors, though it will cost you more. Alright, with all that foundational knowledge in your back pocket, you're ready to dive into the Justworks platform. When you log in, you'll navigate to your benefits center. If you're an admin, you'll see a dashboard with an overview of your team's benefits. If you're an employee, you'll see the options available to you. The first thing you'll notice is the intuitive plan selection flow. Justworks doesn't just throw a massive list of plans at you. Instead, they give you tools to narrow down your options based on what's most important to you. The first and most powerful tool is the set of filters. You can filter by carrier, which is the insurance company offering the plan. Think Aetna or United Healthcare. You can also filter by the network type, which we just discussed, PPO, HMO, EPO, or POS. But the most useful filters for comparison are the ones that let you set a range for the monthly premium, the deductible, and the out-of-pocket maximum. This is where you can start to really customize your search. Let's say you know your budget for a monthly premium is on the lower end. You can set a range, and the Justworks platform will automatically filter out all the plans that are outside of that range. This immediately makes the choices more manageable. Once you have your filtered list of plans, you'll see a plan relativity tool that helps you understand how the plans compare to one another. You'll see a visual representation of how plans stack up against each other in terms of monthly cost and coverage. Plans are often categorized by metal tiers, like bronze, silver, gold, and platinum, which indicate how much of the average healthcare costs the plan covers. A bronze plan covers about 60% of costs, while a platinum plan covers 90%. So, a bronze plan will have a lower premium, but you'll pay more when you actually use the services. A platinum plan is the opposite. High premium, but less out of pocket when you need care. This is a critical moment in your comparison. You need to think about your personal or your team's typical healthcare usage. For a younger, generally healthy team that doesn't go to the doctor much, a high deductible, low premium bronze or silver plan might be a perfect fit. They're not paying much for insurance they don't use, and they have the security of a catastrophic cap with the out-of-pocket maximum. But for a team with chronic conditions or families who use a lot of medical services, a gold or platinum plan, with its lower deductibles and copays, could save them a lot of money in the long run, even with the higher premium. The Justworks platform also provides a detailed breakdown of each plan. When you click on a specific plan, you'll see a wealth of information that goes beyond the basics. This is where you'll find the specifics on copays for doctor visits, specialist visits, and emergency care. You'll also see a list of what the plan covers, from prescriptions to mental health services. You can also use this detailed view to check if your specific doctors or hospitals are in-network. This is a huge factor, especially if you or an employee has an existing relationship with a provider. The platform will often have a link to the carrier's provider search tool, which you can use to confirm network status. With that said, thanks for watching, and until next time.